Further debate, further debate. Representative Torres in debate.
Thank you, Mr. Speaker. Today, as a Hispanic, I rise in opposition to this bill. According to the Pew Hispanic Center, 1 in 3 Hispanics are uninsured. La Raza reports Hispanics are 3 times more likely to be uninsured than the general population. La Raza reports also 84% of uninsured Hispanics live with other family members who are uninsured. According to the Pew Hispanic Center, the average individual yearly income for Hispanics in the state of Florida is $20,000 and will not be covered under this plan. Almost half of Hispanics uninsured use the emergency room, Mr. Speaker, as their primary health care option. This is leading to longer waiting times, higher costs to the hospital, the state and the uninsured, and higher workloads for the emergency room physicians. A large percentage of Hispanics say out-of-pocket healthcare costs are a very serious problem for them because lack of insurance. In my county, Orange County, it is reported over 82,000 are uninsured. Mr. Speaker, this plan does not do anything for those working class, Hispanics, or other people in the state of Florida. And I ask all my members to vote no on this bill. Thank you very much.
Representative Oliva in debate.
Thank you, Mr. Speaker. Representative, I'm a Hispanic too. And I can't imagine why you would say that this does nothing for Hispanics. You know, we talk a lot about all the nuances around this bill, but it's about people. It's legitimately about people. It's about people like Mary, a single mother of 2 whose kids are already on Medicaid, but she can't afford it herself. Saying no to this plan would deny her the kind of coverage that you and I enjoy for $25 a month. It's about people like Maria, a single mother who lost her job where she had health care and had to get a part-time job where she doesn't. Saying no to this would deny her the ability to get the kind of coverage you and I enjoy for $25 a month. And it's about Tom, a man with disabilities who earns too much to be on Medicaid, but too little to qualify for the exchange. These are the kind of tangled webs that we weave when we try to take a plan like Medicaid, which has been dysfunctional for years, which is fraught with fraud to the tune of $1 billion a year. And we think that that's the best thing that we can use to cover everyone. Why would we want to prescribe for anyone, the less fortunate among us, as some people say here, the Hispanics, the minorities? Why would we want to provide any of them or prescribe for them something we won't prescribe for ourselves? Doesn't make any sense to me. This plan gives them the ability to have the quality of care that we enjoy. Why shouldn't we want that for them? I urge you to dig deep and think about what you want to provide the residents of Florida. Do you want to provide them some second-class care, which is already proving to be a failure? Do you want to expand Medicaid and along with its expansion, expand its fraud? If it's $1 billion today, what will it be once we expand it? You know, we talk about the money that we're not taking from the federal government. What about the money that's being taken from us for fraud? You want to expand that? What will that reach? Here is a way to put this in the private sector, to let people enjoy the kind of care that you and I enjoy, that have access that we enjoy. I urge you to please support this bill, and let's give the residents of Florida the very same things we give ourselves. Thank you.